going to talk a little bit about why the interest in survivorship, who are our survivors, what are they telling us about their lives after their diagnosis and treatment ends, and then I'm going to talk about the implications of this for the care that you're delivering out into the community. So for starters, why are we interested in this? Why has this become such a hot area of discussion? In the past 5 years, there have been no fewer than 5 major reports that have come out addressing this area of post-treatment well-being and health for individuals who carry a cancer diagnosis. 2 of those have come from the Institute of Medicine, one on childhood cancer survivorship, and the more recent one on adult cancer survivorship, a Lost in Transition document. A report by the President's Cancer Panel for their 2003-2004 look at what's going on at the national level in cancer trends, and a follow-up report produced by them in 2006-2007 to say what had we learned and where were we going with that, and a report by the Lance Armstrong Foundation in collaboration with the Center for Disease Control and Prevention, again, outlining what they felt it needs to be the trajectory of plans and research that we need to take better care of our survivors. Major reports, and in fact, I would encourage any of you who are interested in this area that you should have these on your bookshelves. And actually, having said that, let me pause for a second and get a show of hands. How many of you at your institutions currently have a Survivor's Day? A lot of hands. How many of you at your institutions currently have a formal program that provides post-treatment services specifically for cancer survivors and their families? Fewer, but growing number of those. Okay. So this is an area that you're all well aware of and is happening very quickly. And so one of the questions back to us is why? And I would argue the main reason we have attention to this right now are the sheer numbers. In 1971, when President Nixon signed the National Cancer Act and declared what would soon become referred to as the War on Cancer, we had an estimated 3 million cancer survivors in this country. Today, that figure is 10.8 million, although actually April is the month when SEER updates all of our cancer figures, so this is a moving target. In fact, in the next couple weeks, the new prevalence and incidence and mortality figures will be released on the federal websites. And if we are to give a more accurate estimation of the number of individuals who are alive today with a cancer history, it's probably closer to 12 million. What these figures do not tell us, however, is the health status of these individuals or where they are on the trajectory. So when we heard in the earlier presentation that Dr. Kristen McNiff gave, the question came from the audience, what are outcomes? That's a very good question, because what we'd really like to be able to say is what are the health outcomes of those individuals who are living long term. It's not enough for us to have individuals living longer. They need to be living better with this history of the disease, and that's really where our clinical challenge is right now. Obviously, there are a lot of factors that have contributed to these trends, and those figures go up at a rate of about 3 to 4% per year. Earlier detection has made the longer survival possible for more and more individuals, newer and more effective, often multimodal complex regimens, more effective adjuvant and maintenance therapies, certainly better supportive care. We're able to get patients through rather rigorous regimens without having to stop their treatments. And there's now growing attention to the surveillance. What do we need to be doing to follow these individuals to keep them healthy over the long term, keep their disease from coming back, but to treat other things? Well, this would have been all fine and good with the numbers going up, and we probably wouldn't be here today except for a very important event that took place in 1986. And that was a gathering of individuals in Albuquerque, New Mexico. These were survivors, clinicians caring for individuals with a cancer history, a couple of individuals who organized services to provide help to them, gathered in New Mexico to say, what's the state of care for individuals who carry this history? And they established what's now known as the National Coalition for Cancer Survivorship. The reason that meeting was seminal is because at that meeting, they decided to redefine what it meant to be a cancer survivor. At that moment in time, 1986, to be a cancer survivor from a medical point of view, you had to be disease-free for a minimum of 5 years. That was sort of the medical definition. These individuals said that's no longer acceptable because more than 50% of people who are diagnosed are now living 5 years or more post-treatment. You can't wait till they get to that 5-year mark to decide, gee, did I want to preserve my fertility? Did I want to spare a limb or have a different kind of surgery or different kind of therapy that would have allowed me to have a lifestyle that I really wish to pursue? You can't wait to have that dialogue. So they said we need to turn this around and redefine your capacity to talk about yourself as a survivor from day one. So this is actually the definition that they put forward, that anybody could call themselves a survivor from the moment of diagnosis and for the rest of their life, whether they died of cancer or something totally unrelated. And under that broader umbrella, they had the wisdom to also include caregivers and family members, which is very important because, as we realize now, they are integral to the care and well-being of our growing population of survivors, sometimes secondary survivors themselves, but we rely on them more and more to help us deliver and monitor the care that's being provided to our cancer patients. They did not intend, with this definition, the coalition did not intend for people to label themselves. I'm a survivor. What they really wanted to do was change the medical philosophy to encourage oncology teams and professionals to have that dialogue very early on with individuals who are diagnosed so that they could look at quality of care outcomes in the decision-making process. It wasn't meant to be a label. And in fact, the advocacy community is very uncomfortable with it. A lot of people say, I don't like calling myself a survivor. To me, that's someone who made it through the Holocaust, got out of the Twin Towers in 9/11. I don't label myself that way. On the flip side, there's some people who said, I'm not just surviving after this, I'm thriving. I've taken this and I've made major changes in my life. So it's not about the definition, it's really about the philosophy. And that is, in fact, the philosophy that the NCI embraces. We do consider individual survivors from the moment of diagnosis on, but I'm going to come back to that when we talk about survivorship research because we have a slightly narrower definition of what that entails.